morning. Let's see. Do I control these? Okay, good. I'm Dr. Tom Howard. I'm in pediatric hematology oncology at the University of Alabama in Birmingham, part of the advisory board, and the reflexive person on South Alabama who represents the hemoglobinopathies is Felicia Wilson. Are you here, Felicia? Would you stand up? There you are. All right. Together we worked on the newborn screening advisory board for a few years. Hemoglobinopathies, in particular, focused on sickle cell hemoglobinopathies, have been a focus, one of the older screened diseases, going back about, not as old as PKU, but going back about almost 25 years now, and has been very successful. Okay, sickle cell disease is a genetic disease. One of the first genetic diseases really demonstrated the cause of with demonstrating one amino acid substitution in the genome that led to the production of an abnormal beta globin. This beta globin, which shows on your left, and normally when it's when it has oxygen around it, is fine. It floats around in solution, and it's deoxygenated. It forms these rigid polymers that pop that round red cell in the lower left to a rigid sickle-like cell on the lower right. We know of long standing that those sickled cells have the capability, have several things happen to them. One is, because of their funny shape, they're destroyed. And being destroyed, they make people anemic. And they leave people with jaundice because of the breakdown of hemoglobin. They also clog up blood vessels in every vessel of the body, potentially, leading to short-term events like painful crises, strokes, blockage of the spleen, increased probability of sepsis with pneumococcus. Ultimately, those events resolve, but the organ remains scarred. Cumulatively over a life of a person with sickle cell disease, these scars add up. The adding up of these scars lead to end organ failure. This is just to illustrate that. A blood vessel is blocked up by sickled cells. It gets blue. The tissue gets blue, but when it heals with a scar. The accumulation of those scars, the number of manifestations with sickle cell disease is staggering. This is only a partial list. And what I've tried to show here is list them all and show that, for example, when the bone marrow is blocked with its blood flow and infarcted, that leads to pain. The hallmark of sickle cell disease, really, painful admissions, painful crises. And when that happens repeatedly, the long-term consequence is shown in blue, which is avascular necrosis. Your hip goes bad, and it falls apart. We've seen that in kids as young as 6 years of age, and probably in the order of 25% of these persons with sickle cell disease, sickle cell anemia, will require hip replacement in their 30s and 40s, by their 30s and 40s. So this is a cumulative thing. For the lung, it starts out with repeated pneumonia. It ends up with lung fibrosis and right heart failure. For the brain, it starts out with maybe silent cerebral infarct, small spot, small blockage of vessels in the brain, or large vessels, or bleed into the brain, as you'll hear about in a few minutes, and leaves you with decreased IQ sometimes, learning problems, and difficulty with neurological problems, and so on with the kidney, and so on. It's a genetic disease. We say sickle cell anemia. The top two panels here represent what we usually call sickle cell anemia. It usually is the sickle gene interacting with other genes. So, for example, shown here on the top left is a person who has a person who's all blue there has two sickle genes. That's the most common, representing about 65% of patients. On the right is about 5% of patients. That person actually has only one sickle gene and has a beta 0 thalassemia gene. The result is the same. They make only sickle hemoglobin, and they have all the problems of sickle hemoglobin. The lower two panels represent two diseases that we call less severe. Those are hemoglobin SC disease, the one on the lower left, in which the patient has one S gene S hemoglobin gene, one C hemoglobin gene. Their cells, again, have a shortened lifespan. They don't have as many of the problems as the persons who have sickle cell anemia. And then there's another sickle beta plus thalassemia who, like the SCs, are a little milder. The SCs represent about 20-25% of patients. The S beta plus thalassemia is about 5 or 10% of patients. What drove newborn screening and the initiation of newborn screening was death. Bacterial sepsis, shown here in the bright red, that's pneumococcus in the blood, occurred before we began to do anything about it in 8 out of 100 patients a year. This is the kind of bacteria you get in your blood if you just have a simple ear infection. Common. 8 out of 100 people per year having sepsis, with a mortality rate of 20 to 30%. And that's what drove the initial screening for hemoglobinopathies. People recognized that, and they said if we could do something about this early, maybe we could avoid those deaths. So it begins there, but it's grown to be something much bigger. I'm not going to go all this, but the story is strung out over 20 years to have effective, 20 or 30 years to have effective newborn screening of hemoglobinopathies. Note, for example, that the whole effort began, even though we had some effective screening methods in the 60s and 70s, it wasn't until 72 that we began to try to think about what to do. It wasn't until 75 that the first state ever screened for hemoglobinopathies. That was New York. By 83, people were frustrated because most people said we need to be screening for these because we can recognize the disease and avoid this death due to sepsis, but no action was taken, no global action. From 83 to 86, people learned that if you simply give the child penicillin prophylactically, you can change the landscape. So with that, 85% of those pneumococcal sepsis episodes were decreased, and the death rate was 1/10 and less of what it was before. Today in Alabama, as a result of that 1986 study and the drive to initiate hemoglobinopathy screening, which I think happened around 1988, 1987, as was mandated or highly recommended by consensus state and tried to be mandated by state law. In 2006, finally, all of the states of the United States were screening for sickle hemoglobinopathies. That's about 30 years to get it across, if I do the math correctly. No, 20 years, I'm sorry, I did it wrong. And what drove it was trying to prevent deaths, but the product has been even greater. With it came comprehensive sickle cell centers, with it became education, with it became preventive care, and all of this grew out of the initiation recognition of newborns early. The whole goal set in 1987 at that consensus conference was to get people on penicillin by 4 months of age. 2 weeks now about in the state of Alabama. Get them to comprehensive care. Several years ago, even 5, 7 years ago, 10 years ago, it might have taken 2 years. But now we see these kids, I'm seeing kids as a hematology specialist in a comprehensive sickle cell center within a month or less sometimes. 90% of them are getting there by 3 months. What happens there? Oops, where do I point? Oh, it is worthwhile to say that these sickle hemoglobinopathies represent probably, on average in any 1 year, I just picked 2013, the second largest, if not the largest number of screen positives in newborn screening. There were 53, invariably about 56 to 62,000 births per year, 53 individuals with sickle cell diseases, okay? And in the same process, we picked up somewhere between 1,600 and 1,400 persons with sickle cell trait who have access to counseling and advice genetically about the inheritance of the disease. This is what happens when a newborn has an abnormal newborn screen. If you have a positive, those are the events that take place. We're downstream, the hematologist and the community-based organization. We initiate penicillin. I've already told you, it gets there by a couple of weeks. We get to see the patient by about 3 months. One of the things that we've done is to do outreach clinics to make ourselves more available to people in the community. And their preventive are things that avoid strokes, renal disease, identify gallstones early. All these preventative strategies grow out of that effort. And then there's access to state-of-the-art treatment, which is hydroxyurea to lower painful occlusive crisis, probably decreased stroke events, and then trombone transplant and other interventions that are necessary. So what's the impact of newborn screening? Well, it's summarized here in this somewhat erroneous slide. Shown on the left is the fraction of persons born with sickle cell disease, and this is the most severe kind, SS and S beta 0 thal. 100% are alive at birth, and by 14 years of age, 30 or 40, and actually only about 40% of them, only about 60% of them reached their 20th birthday in the 70s. You can see year by year, newborn screening came along with about the CSSCD cohort. And you can see since that time in the last 20 years, we have gone from something like 85% of the persons making their 20th birthday to 96%. And if one considers the milder forms of disease, 98% of persons reaching their 20th birthday. Now, I think that's a statement of real success. There's still work to be done. And getting these people to preventive care, preventing strokes. In the state of Alabama, we can prevent 90% of strokes. And in our institutions, we had 5 or 6 kids every year with a stroke. Now we have one every couple of years or every third year. And I'm sure that Dr. Wilson's experience is similar. We wouldn't know how to do that if we didn't have newborn screening that helps us identify all these people and round them up. Now, you're going to hear firsthand from a person who has experienced the frustration and pain of as many as 3 to 6 or 12 hospitalizations per year, the ecstasy of exposure to hydroxyurea, the frustration of stroke, and yet perseveres. And part of his perseverance is I remember seeing him when he was a much younger man than he is now. So I'd like to introduce Mr. Mario Hendricks. Mario? Now, Mario's has SS disease, sickle cell anemia of the more traditional type. He has a daughter who has SC disease, and a daughter with sickle cell trait. You know, Mario represents something that I'm old enough to recognize. I had an experience in a Tuscaloosa clinic about last year. I mentioned this to you. When I sat down and I saw the great-grandmother who had 2 babies with sickle cell disease who died at under 6 years of age with sepsis. And her daughter, the grandmother of the child I was seeing, who was one of the original people who participated in the hydroxyurea trial of sickle cell disease and had had a stroke and was, I think she told me she was 50. She looked really good. I would say she was probably 39. As a matter of fact, when I walked in the room, I thought she was the mother, not the grandmother. That's how dumb I was. And then the mother who had trait, and then the baby in the 4th generation who had sickle cell disease. I think that in itself is a testimony, as well as Mario, to what we've done with sickle cell.
All right. Thank you, Dr. Howard. Good morning, everyone. How are you today? My name is Mario Hendricks, and as Dr. Howard stated, I do have sickle cell anemia. I was diagnosed about 6 months of age. At that time, I was hospitalized for a sickle cell pain crisis. I've started off with my childhood with sickle cell. It was kind of rough because my peers, they didn't understand sickle cell, and people tend to fear what they don't understand, so I was ridiculed a lot and I was teased a lot due to the jaundice of my eyes, and people always picked on me about that and were kind of afraid to play with me because they didn't understand sickle cell. They didn't know it was contagious or anything like that, but that just goes to to the ignorance of people that you have to be educated about it, and it's a hereditary disease and it's not spread through touch, anything like that. And so let's just say I got into a lot of fist fights as a child. I'm not proud to say that, but I definitely did not like being picked on. My father, I think he may have had sickle cell anemia, but I never got to discuss that with him because he passed away earlier in my life, and I wasn't able to sit down to talk to him about that. But I do talk to my mother about it, and she explained the trials and tribulations that she went through of having a child with sickle cell, because I also have a younger brother who also has sickle cell, but he has SC, he has the milder form, and I have the more severe form. So I was the one always in the hospital, always needed her care, and he kind of stayed out of the hospital until he was later in life, where he had some complications, but he still doesn't have much as I have had. I have two more siblings. They only have the trait as well. As an adult, I began to resent sickle cell and got mad and kind of questioned my faith as why God would allow me to be born with this disease. And because I love sports, I'm a big football fan, big basketball fan, but I was never able to participate in sports due to my physical disability. And much as I hated it, it was something that needed to be done because I didn't want to, bring on more complications that I already had by participating in cold weather and extreme heat. And so I found other things to do in school, like I joined the ROTC program, and I began to get on the drill team, rifle team, and color guard, and that was an outlet for me, as opposed to not playing sport. I got to travel and compete in various JROTC competitions around the state, and I still have some great friends to this day due to that. But once I matured, I began to accept sickle cell, not as accepting like this is my life, but I began to accept it as a way to give back and help advocate for it and better educate the people around me who didn't fully understand sickle cell anemia and what it caused in our family and what it does to a patient as far as morale and depression, because it is a debilitating disease. But we all have our own cross to bear, so this was mine, and I carry it, and I try to advocate as much as I can to raise awareness about it. And through that, I was hooked up with during my time at WSFA. I wasn't always able to hold down a full-time job because of my illness, so I worked part-time jobs, but I was able to go to college and finish high school on time. I never let sickle cell stop me from doing that because I love learning, I love school, I loved everything about it. I even had perfect attendance. But high school was rough. It was really rough, but once I graduated and began to live my own life, I decided that I wasn't going to let sickle cell weigh me down. I wasn't going to let it limit me as far as my intellect goes. Maybe I have physical disabilities, but there's nothing wrong with me mentally. And I used that as a way of motivating. Like I said, I became an ambassador for the River Region United Way, and I would volunteer to go to area business around Montgomery and the River Region to share my testimony and help people in hopes that people would donate to their general fund budget. My late friend Hank Schmidt got me involved in that, and I'm still carrying on his legacy with that to this day. My family, like I said, I have 3 kids. I have a son and 2 daughters. Only one of my kids have sickle cell anemia, and that is my oldest daughter. She's 11 years old. But thanks to newborn screening, she was diagnosed at birth, so we was able to get I apologize about that. We was able to get her started out, get treatment for that, get her on penicillin, and get her on hydroxyurea and folic acid, and get her hooked up with a hematologist like almost immediately, as opposed to me. When I was born, I had to wait until I was 6 years old to be diagnosed with sickle cell. But it was later in the late '80s where I actually was hooked up with the community-based program, the Sickle Cell Foundation of Montgomery, to where I could see peers who also had sickle cell, because until that time it was just me and my brother. I didn't know anyone else in the world that had sickle cell anemia. But once I got to go to Camp ASCA and Camp Chandler, I got to meet peers who would share like stories along with me. But it was this one counselor, and that moment stuck out for me from then until my 37 years of age now. But I remember her vividly telling me that, "Oh, you have sickle cell? Well, you won't live to be past 13. Well, I'm standing here today to let you know I just celebrated my 37th birthday. September the 6th, to be exact. So happy birthday to you, sir. So I'm 37 years old, like I said, and with the grace of God, in 2 more years, I've been tripled her prediction, and I'm shooting for 100, hopefully. But having a daughter with sickle cell only revigorated my desire for advocating for this debilitating disease, because once I heard the news, it was a devastating blow to me that she would have to endure some of the trials and tribulations that I had to go through. And it almost crushed me knowing that I had brought a child into this world that would live with some of the things that I went through in life. But then I sat back and I began to reflect that who better as a parent with sickle cell to have a child with sickle cell to help her along in life and to share with her some of the things that I've been through and how she could overcome it, because my mother didn't have sickle cell. Like I said, I was born in '78, and they didn't start newborn screening until the late '80s, and she didn't know anything about sickle cell. We're still learning things about sickle cell to this day. While there's no visible cure for it, there's always hope, and I try to hang on to that notion that there is hope, that one day we will eradicate this deadly disease. But it's been like leaps and bounds with medical improvements thanks to hydroxyurea and folic acid. I went from having 3-4 crises a year until October. I'll be 3 years crisis free. And that right there within itself is a positive, because I hate emergency rooms. I hate doctors. I mean, no disrespect to you guys, and you nurses too. Always want to get your blood samples and all, but I truly appreciate you guys. It's no hard feeling, but I just don't like hospitals. And I've spent enough time in those, and I'm trying to stay away from them as much as possible. But I do appreciate you guys. I do appreciate the strides that the medical industry have made with diagnosing and treating patients like me with sickle cell anemia, and help giving us a better quality of life, because I didn't see it back then, but I have so much to live for, and I have so much on this earth worth fighting for. My complication with sickle cell included 5 surgeries. I had 2 port surgeries. I had my gallbladder removed, and 2 years ago was the big one. That's when I suffered a brain aneurysm. I was airlifted. Well, no, I wasn't airlifted because it was raining terribly that day, so they had to rush me by ambulance all the way up to UAB in Birmingham, and when I arrived, they said I was unresponsive, but, you know, God's not finished with me yet, you know what I'm saying? I got a purpose in life, and that purpose has led me right here onto this stage to share my testimony with you guys in hopes that you guys would carry out and it could help somebody in life. Because believe it or not, we all are affected by, or we all might not know someone directly with sickle cell, but we all are affected directly or indirectly by it. You may have a child who has a classmate with sickle cell, and they're in their study group together, and maybe he's out sick and your child's upset and wondering about his friend. So just take the time, and if you meet somebody or come across someone with sickle cell, encourage them, let them know that there is hope, let them know there is understanding, and that we're praying for them. We're going to pull through it. And I want to take this time now to do something personal. I hope you guys don't mind. I would like to issue a public apology to my mother, because sickle cell, it really presented some challenges in my life, and selfish as it may be, I often blamed her for some of the trials and tribulations that I had to face in my life, and that was wrong. It's not her fault. We all have to go through our own things. So, Mom, I would like to apologize to you personally, but I also want to thank you. I want to thank my sister as well, who is here for support as well, because these two women have been in my life from day one, and they've never wavered with their love for me, no matter how down I get on myself. They would not participate in my pity parties. And because I have such a strong mother and strong family and support base, is the reason I'm standing before you today to share my testimony. And I just want to thank each and every one of you for listening to me, and I hope that you could take some away from what I've shared and be an encouragement to somebody who has sickle cell or anybody who's fighting any disease in their life, because you guys are our support group. You guys are what keep us going, and I appreciate it, and I thank you. Have a great day.